In this video, I'm going to be discussing with you what is direct primary care and how that could potentially save you some money. Hey there, my name is Lesline and I am your favorite nurse yogi. If this is your first time clicking on my pretty face, thank you. Make sure you are subscribed and please stay till the end. Your girl's trying to get her watch time up, but that's neither here nor there because it's the first time you're stumbling on me. So I wanted to talk about direct primary care. What is that? So, in case you don't know who I am a registered nurse with 12 years of healthcare experience, and I'm also a certified yoga instructor with 5 years of teaching experience. And I wanted to really go into direct primary care, like explain that to you in a video, because I, as a patient, have had a primary care doctor who practice under this business model, and I thought it was really beneficial for that time in my life, and we'll explain what that means. And so also explaining to you, like, do you need the direct primary care model, or do you just need like the classic, typical business model when it comes to your health care? So I am getting my information of direct primary care from the American Academy of Family Physicians.org. Okay. So this is where I'm getting it from. And it's a model where a practice and payment model where patients, you are the patient, you're also the consumer, pay their physician or practice in the form of periodic payments for a defined set of primary care services, also known as DPC, which stands for direct primary care. Practices typically charge patients a flat monthly or annual fee under terms of contract in exchange for access to a broad range of primary care and medical administrative services. The DPC practice framework includes any practice model structured around direct contracting with patients, consumer. Okay, it's pretty much repeating. So it's your doctor on a subscription. Okay, so it's, how you do your Netflix and you do your gym membership. It is that, but for your doctor. And I first heard about it from actually a friend of mine. I got this lipstick on my mouth, and I actually just finished eating almonds, and so I keep like making sure. Okay, I think we're good. I feel like I have it like kind of chunky on my lip. Anyways, let me blot. Okay, we should be better. So I heard about the direct primary care model from a friend of mine, and she loved it. She loved it because, not to put all her business out there, but she just had a lot of health concerns, right? And so she loved that she had direct access to her primary doctor via text, call, whatever it was, right? And so she liked it for that. And then she also liked the quickness. So she would be like, oh, I think I have a sinus infection. And she would chat with the doctor, and the doctor would immediately give her the prescription that she needed. So that's why she really liked it. So I remember hearing it from her first. And then I had a health scare where I actually was trying to get my cystic acne clear, and I went to see a dermatologist. The dermatologist prescribed me a medication called Aldactone, which is typically a water pill. And I remember when the dermatologist prescribed it to me, I was like, huh? Because my nurse brain was like, this is for people who have heart failure. I ain't got heart failure. I'm healthy. And they're like, no, like this is now being used for people that have cystic acne because it is a water pill. It flushes you out. It flushes you out. You think of it like a detox, right? If you know those skinny teas, well, it just makes you pee a lot. You're not doing the other one. So it flushes you out, and when it flushes you out, one of the side effects is clear skin. I said say less, right? Like clockwork, because I had to take it twice a day, okay? Like clockwork, on the 30th day, one piece of itching, I started itching my whole body, right? And I was like, oh, maybe it's because of this thing. Like I was actually trying this holistic recipe, golden milk, which is like turmeric and milk and all these things, right? I was trying that for other things. So I was like, and it had cinnamon. And so I was talking with my husband because he like has like allergies and all these things. And I'm like, why am I itching? And he's like, well, what have you eaten that's new? And so I was like, I had this golden milk. Maybe it's the cinnamon. He's like, okay, maybe it's that. Stop eating that, right? And I was like, okay, that's easy. So I eliminate that, and the itching gets worse. And so then it's like day 2, day 3, and I'm itching. And again, because my husband always, like, he has health things going on, he was like, yeah, you're gonna probably be itching for 14 days. Like, that's what he said, right? And I was like, 14 days? You're wrong. When I tell you, like clockwork, he was right. 14 days of straight itching. On day maybe almost 7 days in, my lips swole to the size of Hitch. I already have big lips, very full lips. I'm very thankful, right? They were Hitch size. The movie Hitch with Will Smith. Even if you haven't seen the movie, you probably have seen memes and whatever where his lips swell like big. That's what my lips looked like. Once that happened, I freaked the out and I was like, I'm going into anaphylactic shock. Like, that's what's happening. Okay. And it's so interesting because as a nurse, at least for me, is like I go from 0 to 100 real quick because I've seen these kind of things happen. So I'm just like, oh my God, it's happening, right? And I go to the emergency room. I get a steroid shot called Decadron, right? And the swelling slowly went down. It was very slowly. My throat did not close, so it wasn't a true anaphylactic shock, but like typically, and everybody shows allergy different, but typically like once you start seeing that lip swell up and then the eyes and the face, that's called angioedema. The throat is most likely to follow thereafter. It will not go in that exact order. Again, everybody is different, right? But that, when I saw the lip, I was like, oh my God, angioedema. But angioedema, lip, eyes, face, like that whole thing. And then we go to the neck. So I do that, and then, they sign you, they write you off pretty much. Like, that's the thing with emergency. They are there just for the emergency, right? And that's why it's very important that you have a primary care physician in your Rolodex. Like, you are needing to see your primary care physician at least once a year, right? But I remember, because this happened like almost 3 years ago now, they're like, okay, here you go, bye, giving you your discharge paperwork. Make sure you see your doctor like within a week. So I did, because I was like, I need to know why I had this reaction. And when you go to the emergency room, I want to be clear, they are there to treat the urgent need, which for me was, your lips are swollen, we need to get the swelling down. That's it. They are not there to figure out what caused the allergy, blase, blase. They're not there for that. And I just want to be clear with that. And I actually made a video. I might redo that, but where I explain the difference between urgent care, emergency room versus urgent care. They're separate, right? That's a separate video. But I know, because of being a nurse and also just being of the world, people be like, man, I went to the emergency room and they didn't even help, right? And please do not, like, I'm not saying this exactly happened to you. Again, this is just education. This is not medical advice. You might not have felt like you got the care you needed because you were in the wrong level of care, okay? You probably needed to go to urgent care. And then my other question, though, for you, like real talk, when is the last time you saw your primary care? So going back to this story, I made sure to follow up and see my primary care doctor. She has the records, but you still tell the whole story. And she's like, okay, I'm going to make you see an allergist. I'm going to give you an EpiPen. I said, whoa. This is just one time. And I also was like, whoa, because my son, he used to, thank God, be allergic to eggs. He's no longer allergic to eggs. So we've always been on high alert since my son has been born. And I've been on high alert actually since I've known my husband, because he has allergies and stuff. So when I tell you it's just one piece of, we're always like, in this house. That's why I'm a yoga teacher, because I got to bring those shoulders down myself personally. And so when she said the EpiPen, I said, whoa, right? I was like, I don't need all that. I just want to know why I have this. What was it? The medication? And they're like, we have to rule out. And rule out means I had to go see the allergist and do the tests to see if it was any common allergens like peanuts, eggs, shellfish, cats, dogs, dander. Like, am I allergic to any of that? They did the whole test. I wasn't allergic to none of that. We're at the allergist, guys. So I'm there, and the allergist is like, "Yeah, you're not allergic to anything. I guess it was a systemic allergic reaction, and systemic means like my whole body, because my whole body, like I told you in the beginning, was itchy to aldactone." And I was like, "Wow, that's wild, right?" Because I'm not somebody that has any allergy, and so after that, though, I did not like. This is where we're getting to like why I then sought out a direct primary care physician. I did not like the primary care provider I had. I felt like, and it was a virtual appointment, so there's that, but I don't know, I just felt like she kind of just signed me off. She was like, "Okay, well," and it makes sense because she is primary care. Primary care, also known as your general physician, they oversee like all of it, right? So hindsight is 2020, but in the moment I was just like frustrated with how I felt like she blew me off. And so I was like, I'm gonna see if I can find a different provider. And I had actually been following this one doctor. She's no longer in this area, but I was following this one doctor that was in this area, and I was like, I'm gonna go with this doctor. And she was a direct primary care physician. And so with that, it was night and day in the sense that the first appointment was a full hour. It was a full 60 minutes where I sat with this doctor, and it was a nice little office, not like little in the sense like, but it was just a nice office. It was very like therapeutic feeling. We sat in her office. So we were at the desk. She's on one side, I'm the other, and she's just asking me questions, right? And we're having a conversation. That was like 30 minutes of the appointment. And then after we talk, then she put me on the table in another room and, did an actual physical assessment, take my blood pressure, listen to my lungs, feel the important areas of my body, right? And I was like, whoa, this felt very thorough. And we then both came to the conclusion that, yeah, it was probably the aldactone that gave you the medication. And then after that, she was like, "Hey, I want you to get this type of blood work done." And it was like more detailed than the generic blood work from that other primary care doctor. And I want to be clear, the other primary care doctor I had was under my insurance, right? And there's a lot with that. When you have a provider under your insurance, there are certain things they have to hit so that the insurance will pay them. How do I know this? I work insurance. So with that being said, there's a certain number of patients that they have to see within a day. So I know these things as a provider, like healthcare provider, but it's just like when you're the actual patient, it's like, damn. So with that though, there's also just the generic blood work that they order, because that will be covered under the insurance, right? So with the direct primary care model, because you are paying out of pocket, you're paying out of pocket, and then two, they are, at least with my experience, they're going to have you order you labs that you typically wouldn't get with a doctor under insurance. Because again, the doctor under insurance is only going to do the things that the insurance will allow. So the direct primary care model, though it's in the name, it's direct in the sense that you see just that doctor, right? And then also it's you're paying the doctor. Like, you're not paying the insurance who then pays the doctor, okay? It's directly, your money is directly going to the doctor, right? And so I did that blood work and all that, and it was just a great experience. After I figured all that out, the direct primary care model I realized was not for me, because I'm not somebody that has like a lot of health conditions, praise God, at this time in life, thank you God, right? But if you're somebody that does have a lot of health conditions, or you're like you're in a transitionary phase of life, maybe you became a new mom, maybe you're perimenopause, maybe you're menopausal, and there's just a lot going on, right? I would recommend considering direct primary care, like seeking out a physician that does direct primary care, because they're going to order you labs that you probably never heard of. You have access to just them. Your appointments are thorough. And what else is it gonna say? Oh, the money aspect. So yes, it is a subscription, right? It's doctor subscription, which I think, if you're I know people roll their eyes at subscription, but honestly, if you are trying to eliminate, because, in this economy at time of recording, it's April 20th, 2026, and I'm on like day 74, 75 of 100 days of YouTube. So I get in this time of me recording that people are like, we're pinching pennies. I understand. Eliminate your Netflix, eliminate the gym membership, because I know you probably ain't really using it, real talk. I need you to see the direct primary care doctor first, and then we circle back to the gym membership, and you can just work with me. I'm way cheaper than your gym membership, promise. And so with that, so how did I pay for it? I used my health spending account or health savings account, which is also known as my HSA. So it didn't even feel like I was spending my money, if I'm gonna be honest with you, because that money come out before I even get my actual paycheck. So that is what I'm gonna close with, is if you're like, girl, I don't got the money for direct primary care, I highly encourage you, if you are employed, to see if you have, like, once new enrollment happens again, to enroll into your HSA. It will save you more money in the long run. I know a lot of us are like, I gotta get all the money I can get from the people's job. I hear you. But in the long run, if you do not take care of your health, it is going to cost you more. So it's better to just have a little bit every 2 weeks, or however the cadence of payment is for your job. Have them take a little bit out every 2 weeks, right? That's what it is for me. And then you have this money. And what is amazing about your HSA is that it is your money. Because there's also another type of savings account called the flexible spending account, or flexible savings account. That's your FSA. That one it ends at the end of each calendar year. So if you don't use the FSA money, it's gone. That money is not your money. So for example, with me, I recently left one corporate job to go to another corporate job. That HSA that I had at that first corporate job, I brought it over. I have it. Like, it's in that account. It's not going anywhere. And I can invest part of that money now that I reached over $1,500. I actually now have like $3,000. I can invest that money into like an actual investment account for like, investment. So it's just really nice. And then I believe it's like triple tax. I'm not a financial advisor, but like because taxes just happened, we used, like, I had to write that off so I can, like, yeah. Okay. So really consider that. So that is, and I didn't, like, we're almost 20 minutes, but that is what the direct primary care model is. And I think and what was also cool was my doctor, she was also really into like aesthetics, meaning like she did like facials, like doctor grade facials for people that have hyperpigmentation. She did like, I don't know if she was doing Botox or was considering, but there was like certain things, and I would like, she left now, but I would have been more comfortable doing like Botox or fill, like those type of things with her, because she's a medical doctor. That's just a little like tip there in this world now where, their aesthetics is a thing, especially because a lot of us now are on front facing. And I'll leave you with this. If you're gonna get the Botox or anything done with your face, please go to a medical doctor. It's no shade to the people that might get a certificate. I don't know. I don't know where they're getting the certificate from, y'all. I trust the medical doctor. So that's just a tip for you. So anyways, that is everything about direct primary care. If you have questions about it, or you're like, where do I find it, or whatever it may be, honestly, I know this is weird to say as a nurse, but consider like your favorite doctor that you follow online. See if they're in your area, see if they do direct primary care model, and go from there. Because if you trust somebody online, like you already feel like you know them, that parasocial relationship, ideally, if you connect in real life, it should just feel easeful. So yeah, I would say social media first, or just ask around with friends, because it depends on state and all of that. But I'm going to close with this. Make sure you like this video, comment, subscribe, and I'll see you same time, same place tomorrow. Okay, bye for now.